time, story time. So I had a client that needed to have a surgery, and it was a scheduled surgery, not an emergency surgery, so they did have prior authorization. And then 2 weeks later, they get a bill in the mail for $30,000. Mind you, they're covered by insurance. They presented their insurance card at the appointment check-in. Provider was given all the information that they needed to bill directly through insurance. But did they? Yes, actually they did. And they even got paid some by insurance. But sometimes what happens is either one, a fluke in the system and the wrong bill goes to the wrong person. And unfortunately, other times it's a scare tactic. So obviously my client calls me freaking out because they don't have $30,000 to pay to this provider. But because they work with BHM, I can help them out. So first thing we did is I told them exactly who they needed to talk to, what that process looked like, what paperwork they needed to send in. And because I work with carriers that actually have my client's best interest and savings at heart, that's all my client had to do. Now the carrier takes it from here. They go after the provider, they make sure that my client stops receiving bills, and they send their legal departments in if they need to. Now, my client can call me anytime with any questions for any reason, or even just advice on how to best utilize their insurance. I know the carriers inside and out because I read all the legal jargon and all the legal contracts, and because I have my health insurance license. So I know exactly how to get the services that you need for as little out of pocket as possible, depending on which carrier you're with. And they don't ever pay me for that. My clients never pay me an invoice directly, ever. Any fees that I get to collect for that client, it's already built into their premiums. And remember, my clients save an average of 35% when they switch to me. Not a single one of my clients is upset that my fees are in the premium, because the premiums are still cheaper than what they were paying before. So imagine if you can have a professional advisor at no cost to you, and any fees that they are introducing, you still end up saving 35% off your monthly premiums. And now you have better coverage, and now you have somebody who can teach you how to utilize that coverage. And heck, while we're at it, let's throw in free self-care, massages, manicures, pedicures, free mental health, and a whole bunch more. You're sick of getting screwed over by health insurance carriers, or just sick of the premiums that you're paying, or 25% rate increases year over year over year over year over year, then it's time for you to become my client. All it takes is you have to have 2 lives, can be husband and wife, that's okay, with most carriers. You have to have an EIN for a group, but now I'm also available through the marketplace. There's a link in my bio. You can fill out a contact form if you want to learn more, or if you're ready for hard numbers to see exactly what we can do, fill out the quote form. Chat soon.